in the coronavirus. Dr. Jessi Gold is a mental health expert who teaches within the Department of Psychiatry at Washington University in St. Louis. She spoke with me about the tough decisions on school reopenings. Dr. Gold also discussed how to cope with the mental strain of the pandemic.
So right now we're hearing from colleges as the colleges are slowly deciding what is best to do for the college students. I see college students as patients, so I was seeing them before they made the decision to go home for break. They kept them home for break. That's a big change to their life, a big change to their social life. Social life is a big reason why people are able to feel good. It's a big reason why people have good mental health. And I think when we make these big changes, we have to be aware that they have emotional repercussions. Being able to cope by being around other people is part of the reason why we are human. We are social creatures. So we can say that they have no repercussions to emotional health, but that's false. So we have to be thinking about that, and as a big aspect of what we're thinking about. But of course, the physical health is really important, and we have to put that first. So when we think about these things, we have to be thinking, can we put things into effect that might also help with socializing? I think it's really important to think about how we have all of these technologies that can still connect people. And we're really lucky to live in an age where we have all of these online ways that we can connect. Social media has negatives in young adults, but also has great uses right now, which I, as a mental health provider, usually don't love social media, but is really positive right now. And I think that that's just something we have to be considering and something we have to be thinking about.
More broadly speaking, how do we take care of our mental health and also follow social distancing guidance, wear the mask, just follow these strict rules overall? How do we reconcile the two?
It's really, really hard to do. I think that's the first thing we have to say. This is really hard. Nobody's been through like a pandemic at the same time as racism, at the same time as constant changes in science and regulations. And we really have to give ourselves a little bit of a break, and we have to say, this is hard. We're all learning together. And I think that's the first thing we have to do. Then we have to learn to live with uncertainty a little, and none of us like that. We're really like to be able to say, what am I doing tomorrow? And not just tomorrow, but like 20 days ahead, 3 months ahead. And we really kind of have to shift that mentality and be a little more comfortable living in this uncertainty zone of like, what am I doing just in the next couple hours? Or can I be okay saying like, this is uncertain and I'm okay with that? And we have to live with that a little bit, and that's hard for people, but I think we can do that because recovery communities have done that for a really long time. People who live with chronic illness have been doing that for a long time. People who live with cancer diagnoses have been doing that for a long time. It's very possible to shift your mindset to not being certain all the time and still be happy. I think that there are ways to socialize and to cope and enjoy your life and still follow these social distancing and public health necessities. So you can wear a mask, you can social distance, and you can still have friends, and you can still enjoy your life. I think it might not be the life that you were used to living, and there will be some grieving and some mourning with that, and that's okay. Like, we can mourn the life we were living, and we can be frustrated and angry and upset that that's not what we're doing right now. But at the same time, we can also try to figure out how we can cope with what we have right now, which is I'm going to put on a mask and I'm going to figure out how I can still have a birthday party with a couple of my friends in a social distance environment and still enjoy it, because that's what we can do right now. And I think people are trying to do that. And I think it's really important to do that, to model that for your kids, to model that as best as you can, because it's possible to do. And I think that's the only way we can keep getting through this and really enjoy it and really support each other through it too.
It's a very important perspective. Dr. Jessi Gold, thank you so much for your time. I appreciate it.
Absolutely, no problem.
Counselors are seeing an uptick in patients from the Black community as they deal with both the coronavirus pandemic and racial inequality.